Assalamu alaikum. This is Jahangir and you're watching Medical and Nursing Lectures. So our today's topic is forms of oral medications. Medication forms commonly prepared for administration by oral route, although we have other forms of medication also like IV, IM, but this kind of medication we may need to give those medication by oral route. And them as Caplet. Caplet shaped like capsule and coated for ease of swallowing. You can see that in the picture that this kind of medication, which is known as a caplet, can be easily taken by the patient. Another type is capsule, medication encased in gelatin shell. You can see that also in the picture. Now, what is a tablet? Tablet is a powdered medication compressed into a hard disk or cylinder. In addition to primary medication, contains binders, adhesive to allow powder to stick together, disintegrators to promote tablets dissolution, lubricants for ease of manufacturing, and fillers for convenient tablet size. Enteric coated tablets. Coated tablets that does not dissolve in stomach. Coating dissolve in intestine where medication is absorbed. We make enteric coated tablets that to protect that from the destruction of HCl inside the stomach. So that is why we make enteric coated tablets. Elixir. Clear fluids containing water and or alcohol, often sweetened. Extract, syrup or dried form of pharmacologically active medication, usually made by evaporating solution. Solution, substance dissolved in water and syrup. Suspension, finely divided drug particles dispersed in liquid medium. When suspension is left standing, particles settle to bottom of container, and this kind of medication should be shaken before use. So every time we should instruct the patient that shake this kind of medication before use. Now syrup, medication dissolved in concentrated sugar solution. Other oral forms and terms associated with oral preparations. First one in them is called Troji. Flat round tablets that dissolve in mouth to release medication, not meant for ingestion. And I think you have ever noticed this kind of medication we use in the sore throat. Aerosol, aqueous medication sprayed and absorbed in mouth and upper airway, not meant for ingestion. Sustained release, tablet or capsule that contains small particles of a medication coated with material that requires a varying amount of time to dissolve. Medication forms commonly prepared for administration by topical route. Ointment, semisolids externally applied preparation usually containing one or more medication. An ointment is 80% oil and 20% water, like Polyfex. Cream, a cream is 50% oil and 50% water. Liniment usually contains alcohol, oil, or soapy emollient applied to skin. Lotion. Liquid suspension that usually protects, cools, or cleans skin. A lotion is similar to a cream, but it's in even lighter or less thick formulation. Paste. Thick ointment absorbed through skin more slowly than ointment, often used for skin protection. Transdermal disc or patch. Medication disc or patch absorbed through skin slowly over a long period of time, e.g. 24 hours or 1 week. Medication forms commonly prepared for administration by parenteral route. Solution: sterile preparation that contains water with one or more dissolved compounds, like pyranol solution. Powder: sterile particles of medication that are dissolved in a sterile liquid, e.g. water, normal saline, before administration. Medication forms commonly prepared for installation into body cavities. Intraocular disc: small, flexible holes similar to contact lens, consisting of two soft outer layers and middle layers containing medication. Slow release medication when moistened by ocular fluids. So you can see that in the picture. Suppository: solid dosage form mixed with gelatin and shaped in form of pellet for insertion into body cavity, rectum, or vagina. Melts when it reaches body temperature, releasing medication for absorption. So the common types of them is Napa suppository and glycerin suppository as well, which we use for the constipation, to relieve the constipation. Thank you. Please subscribe the channel and press the bell icon.